Did you know that many people have thyroid dysfunction and don't even know it? In fact, up to 60% of Americans have a thyroid disorder and don't even know it. Why is this important, you ask? Because thyroid dysfunction, when it's untreated, can lead to very serious complications and outcomes. So it's really important that someone know that they have the disorder in order to prevent some of these outcomes. For example, individuals who have thyroid dysfunction are more likely to experience cardiovascular disease, infertility, and osteoporosis. Women who are pregnant with untreated thyroid disorder are more likely to have miscarriages, preterm births, and are more likely to have a child with severe developmental issues. And so it's really important that we get the word out that if you may be at risk for having a thyroid disorder, you need to get treated, because if you don't, you can have some serious complications that were otherwise preventable, because thyroid disorders are very well treatable. The medications work, they are effective, and it's very simple to follow. Here's the other thing that you should know. About 12% of Americans at some point during their lifetime will be diagnosed with a thyroid disorder. That equates to about 20 million Americans at any given time are affected by thyroid disease. Now, women in particular are more likely to experience thyroid disorders. In fact, women are 5 to 8 times more likely to have a thyroid disorder. Now, it is really important that you continue to be seen by your primary care clinicians and continue with having annual evaluations. Why? Because a lot of the symptoms for thyroid disease overlap with so many other conditions and are really non-specific. So having things like lethargy and fatigue, unexplained weight gain or weight loss, skin issues like dry skin, having digestive issues, constipations, or even fecal urgency, having mood changes, more likely to have depression symptoms, having menstrual disorders, having infertility issues, having palpitations or symptoms of anxiety and nervousness, being intolerant to being cold or hot. These are very non-specific symptoms, and ordinarily you wouldn't necessarily think that you may have a disorder, but these are very common symptoms for patients who have thyroid disorders. So it's really important that, one, you're mindful of the symptoms you're experiencing and that you speak up and let your primary care team know that you're having these symptoms so that they can evaluate whether or not you may have a thyroid disorder. Or sometimes thyroid disorders are a little bit more subtle, and you may not necessarily be as aware that you're having the symptoms. So that's when having an annual exam and having a primary care team is really crucial, because they then can keep up with the annual screenings and then be able to detect something that may not necessarily be as symptomatic. The reason why I'm bringing these issues up is because in the process of discussing two very important cases, one with Savali Kraft, who is an Air Force vet who was affected by heart failure, and the other with C.G. Graham, may she rest in peace, who has passed away as a result of having AFib or complications related to AFib. The thing that they both had in common was that they also both had thyroid disease. And that led to the discussion of the fact that thyroid disorders are linked to cardiovascular issues and complications. And that's something that's not talked about as much. So we're going to talk about it now. Before we get back into that episode and the discussion linking the two, we want to first welcome you to the platform. Thank you for visiting. Thank you for supporting. If you haven't done so already, go ahead and click subscribe, give us a thumbs up, and don't forget to hit that bell so that you are one of the first to know when we are dropping another episode like that. That being said, thank you so much for joining us. Make sure you check out the full episode that we posted about heart disease. But now let's get into the topic of thyroid disease and heart disease and how they are linked, and the things that people are not aware of, but may be experiencing complications that can otherwise be preventable. We also learned that in this particular story, as well as in the story of Savali Kraft, that there is a common link between thyroid disease and heart disease, or a common association, I should say, because I'm not sure that their thyroid conditions directly impacted their heart disease. I can't draw that conclusion in these two stories, but I can definitely say that in general, there is a very well-known link between heart disease and thyroid disease. And there is also a known link between heart failure and thyroid disorders. And unfortunately, Black women are also known to have more aggressive forms of thyroid cancer and are also more likely to have Graves' disease, which is a type of hyperactive thyroid. That means hyperthyroidism. So let's talk a little bit about the thyroid and the heart. Now, overt thyroid disorders are very much linked to heart disease. And when I say overt, I mean that not only is the stimulating hormone, the one that controls the function of the thyroid gland that sits in front of the throat, is abnormal, but also the hormone that's produced by the thyroid gland that then regulates the organs in the body is also abnormal. That is when you have overt disease. Now, you may have individuals who have subclinical disease, meaning they start to show dysfunction of the stimulating hormone that controls, again, the function of the thyroid, but the hormone that's released by the thyroid continues to be under control. There are some things to consider when it comes to subclinical disorders, and I'm going to mention those in a few moments. But let's talk about the overt thyroid disorders. Now, you have two groups of overt thyroid disease. You have your hyperthyroidism and your hypothyroidism. Now, the thyroid is very important in controlling our metabolic rate. So it dictates to several organs how fast to work or how slow to work. It determines the rate of function. And the rate of function can either slow down the bowels or speed up the bowel, slow down the heart or speed up the heart. And that's really important because when you're in moments of stress, you want the thyroid to do what it's supposed to do. And when you're in the moments of normal stability, you want the thyroid to be able to downregulate. So it's a very important organ. And when it is abnormally functioning, it can impact several systems, including the reproductive system. So women who have thyroid disorders may also experience abnormal uterine bleeding. So that's important to know that if you are experiencing uterine bleeding that is abnormal, whether it's irregular menstrual cycles or random bleeding in between your cycles, whatever the pattern, or heavy bleeding, your thyroid is one organ that the function should be checked, especially given how common thyroid disorder is among women. And women will oftentimes be diagnosed with autoimmune conditions of the thyroid specifically. Now, let's talk about how the thyroid impacts heart function. The thyroid, when it is overactive, is hyperthyroidism or hyperactive thyroid. And when the thyroid is overproducing hormones, it can cause the heart to go into a dysrhythmia. It can cause an abnormal heart rate or rhythm of the heart. And when the rhythm of the heart is thrown off, that can then result in two types of heart disease issues. Some people may experience a high output cardiac failure. So we talked about what heart failure is. And other individuals may experience an actual tachycardia, which is a fast heart rate, induced cardiomyopathy. That's where the heart muscle itself is weakened. Now, individuals who have hypothyroidism are those who have an underactive thyroid, and those individuals can also have a heart condition, as both disorders are linked to heart failure. But let's talk about how the underactive thyroid can impact your heart function. Now, unique to the hypoactive thyroid, which is very different from the hyperactive thyroid. The hyperactive thyroid seemed to have more direct impact on the heart. A hypoactive thyroid seems to have more direct and indirect impact of the heart. You see, when it's underactive, it can cause a slowing down of the heart rate, and also it decreases the contractility of the heart muscle. But it also has other impact that can indirectly affect the heart health. So an underactive thyroid can also lead to an increase in someone's blood pressure, and it can also increase someone's cholesterol as well. And so when we start to see a rise in your cholesterol and a rise in your blood pressure, you may want to pay close attention to what's going on with your thyroid. And we know that hypertension, and we know that also an elevated cholesterol can lead to coronary heart disease and can lead to also a dysfunction in the way the heart contracts. When it comes to hypertension directly. So keep in mind that a hypoactive thyroid doesn't just have a direct impact on heart function and the contractility and the rate of the heart, but also has an impact indirectly on other factors that can then impact your heart health. Now, what's interesting about even a subclinical hypothyroidism is that it too can increase the risk or progression of heart failure. So, hypothyroidism, when it is overt, can lead to or worsen heart failure. But even when it's subclinical, it can also worsen or cause the progression of heart failure. And so it is important that when someone is diagnosed with subclinical hypothyroidism, that we don't just pay attention to the numbers, but we pay attention to the full picture of what's going on, because changes in their blood pressure and changes in their cholesterol may be a hint that there is need for medical treatment. Subclinical hypothyroidism shouldn't just be a condition that the labs are just continue to be monitored, but really taking into consideration the full picture of the individual's health, including their risk factors, including their historical family risk factors, and also looking at their likelihood of developing heart issues beyond just the thyroid. And so the thyroid may be contributory to that. Now, what's interesting about subclinical thyroidism is that it too can increase vascular resistance, which is why it can then lead to an increase in someone's blood pressure. It decreases the compliance of our blood vessels, and it can also decrease or impair the contractility of the heart muscle. So individuals who may have a thyroid hormone level that remains normal, and that's the hormone that's released from the thyroid, but may have a very elevated stimulating thyroid hormone. That means the hormone that stimulates the thyroid to release the thyroid hormone, the thyroxine, is significantly elevated. So individuals who have levels of above 7 to 10, especially, really should be considered for medication, because we know at higher levels of the TSH that there can be some impact on their heart and cardiovascular health. So keep that in mind if you are an individual who have subclinical hypothyroidism, that it's really important to look at other factors, and really important to look at the level of the TSH and not just looking at the thyroxine hormone, the hormone that's released from the thyroid. And I'm talking to myself as I'm talking to you guys, because as I've shared with you, I have been diagnosed with Hashimoto's disease, which then has led to a subclinical hypothyroidism. So it's important also for me, as it is for you, to watch those levels. And unfortunately, these outcomes are not ones that can be overcome with just exercise, because thyroid dysfunction can also impair your ability to tolerate exercise to begin with. Let's talk about that. So when you have an underactive thyroid or hypothyroidism, you may have difficulty tolerating or enduring an exercise regimen, simply because the underproductivity of the thyroid hormone, or the low levels of thyroid hormone that's released to the body, impairs oxygen delivery to your organs. If you're someone who is affected by hypothyroidism, that's an underactive thyroid, it may be difficult to tolerate or endure during an exercise workout. It's not in your mind. It's simply because with hypothyroidism, you have decreased oxygen delivery to your organs and you have a very slow metabolism. And so fatigue or poor endurance is common. The opposite is true for individuals who have hyperthyroidism. With hyperthyroidism, individuals may experience a very fast heart rate that can then lead to muscle fatigue. So today we have emphasized that heart disease is an important topic to continue to be discussed and continue to be explored for ways of intervention for Black women. We talked about the fact that cardiovascular health is a leading cause of maternal mortality in the United States. Black women continue to have disparities when it comes to maternal health outcomes and to cardiovascular health specifically. Unfortunately, these two stories of Savali Craft and the story of C.G. Graham, may she rest in eternal peace, are reminders of the fact that cardiovascular health affect Black women, not just directly in terms of our genetics and in terms of our outcomes, but also in how we are treated within the healthcare system. And so it is important that we continue to address these healthcare barriers so that Black women receive the health care that we deserve to minimize our risk and adverse outcomes when we are diagnosed with things like atrial fibrillation, or heart failure, or cardiomyopathy. Cardiomyopathy being unfortunately one of the common outcomes when it comes to cardiovascular health that lead to maternal mortality in Black women, in addition to hypertensive disorders such as preeclampsia. And also, it is important for us to continue to pay attention to the thyroid, not just for the function of the thyroid, but also for its secondary outcomes, which can include heart disease. I hope I have helped you in understanding heart disease and heart disease impact in Black women, the need for continued resources in education and awareness, but also for us to work collectively to break down these barriers. I thank you guys for joining me today. I am Dr. T, the hand behind the handle of Healthy Bum Club right here on YouTube and healthybum.club on Instagram. I thank you guys for joining me today, and I hope to see you guys when? The next episode. Get your heart health, get some workout, get the information out. Let's go. This is Dr. T, just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe